Welcome to this session on the development and feasibility testing of an intervention to inform acute hospital patients in England about the novel role of the physician associate. My name is Francesca Taylor and I'm presenting on behalf of the study team, Jonathan Agidi, Raki Chauhan and Zina Ladva from St George's University Hospital's NHS Foundation Trust in London, and Sally Brearley and Professor Vari Drennan, who with myself are from the joint faculty, St George's, University of London and Kingston University. Physician assistants, known as physician associates in the United Kingdom, are one of many new mid-level practitioner roles being introduced worldwide, advocated by the World Health Organization to address medical workforce shortages. Although PAs have a 50-year history in the United States, they are a recent introduction to many more countries globally. Studies in England report poor patient recognition and comprehension of the PA role among hospital patients. Furthermore, patients can mistakenly perceive PAs to be doctors, with a lack of transparency having potential negative implications for patients' trust in the PA role. There is also evidence of a positive association between hospital patients' ability to identify clinicians involved in their care and improved patient-clinician communication and patient experience and satisfaction. Explanatory theories suggest reduced psychological stress experienced by the hospitalised patients. No studies, as far as we are aware, have developed an intervention to inform patients about the PA or any other new professional role. Nor have there been any studies of interventions developed with patient and public involvement and engagement to introduce any hospital practitioners to patients. Given these evidence gaps, our study addressed the following research questions. What is the hospital patient preferred method of introducing the PA role? And is the preferred method feasible to use, helpful or otherwise in understanding the PA role and acceptable to hospital patients and PAs? The study was undertaken in two phases. Development of the intervention was underpinned by an adapted, experience-based co-design approach. Volunteer patients, patient representatives and PAs engage with study researchers in the design process. First, a facilitated workshop was used to generate intervention ideas for introducing PAs to hospital patients. Patient responses to the ideas were then explored qualitatively to enable insights into patients' attitudes and preferences. 6 intervention ideas were presented individually to patients in written and visual form on A4 size paper and to a structured, rotated format. The ideas included the PA title on badge and lanyard, a standardised script for PAs, 2 poster designs and 2 leaflet designs. 13 adult hospital patients and patient representatives receiving care from a PA participating in the study participated in face-to-face interviews in 1 acute hospital trust. Findings from the interviews were shared by a researcher and discussed and interpreted together with participants in a second workshop. They were then facilitated to use the outputs to construct the intervention design. The intervention developed was a 2-sided, hand-sized information leaflet with black wording on a yellow background, given to the patient with a verbal, personal introduction of their choice by the PA. Each PA was also to handwrite their name on the leaflet. The second study phase undertaken was feasibility testing. PA participants were asked to use the intervention for each inpatient they attended over a 3-week period. 20 adult patients and patient representatives who received the intervention were interviewed to understand the context in which the intervention was used and their experiences of receiving the intervention. Interviews were undertaken in the acute stroke, orthopaedic and surgical oncology units. For 5 participants, English was a second language. 3 PAs were interviewed, 1 participating PA having withdrawn from the study after phase 1 due to work pressures. They were asked about their experiences of providing the intervention. The interviews were undertaken in the same acute hospital study site as phase 1. Data were coded and analysed thematically, informed by evidence-based guidance for evaluating patient information leaflets. Turning now to the findings. Interestingly, few patient participants reported reading the information leaflet when it was given to them. Most participants described delayed use, putting the leaflet aside and reading it at a later, personally appropriate time. For many participants, the personal verbal introduction by the PA before being handed the leaflet was important in facilitating their use of the leaflet. As one patient participant reported, she explained it a little, which is probably why I kept it to read later on. PAs also adapted how they used the intervention, adjusting how and when they introduced themselves in the leaflet to suit their personal style and work context. For example, one PA participant described how they preferred to complete routine patient interactions such as taking bloods and return later with the leaflet. Another participant reported introducing themselves at the start of a patient encounter, but not handing over the leaflet until the end of that encounter. The PA participants expressed some initial apprehension about using the intervention, particularly in terms of how patients would respond, but reported that use became easier with practice and not experiencing rejection. Plaudits were expressed by many patient participants for the leaflet's handy size and card format, making it feasible to retain for reference while an inpatient, and potentially possible to slip into wallet or handbag when leaving the hospital. The colour was considered eye-catching and attention-grabbing. There were also favourable comments about the concise information in easy-to-read, legible, straightforward language. The dominant communication was that the PA is a new role in the medical team and what PAs are trained to do and cannot do. Although the leaflet did not explicitly state PAs were not doctors, this was the general understanding. Some patients talked about the PA being a coordinator between patient and doctor. Others suggested that the PA role had been introduced to support doctors. As one patient participant said, they seemed to be between the doctors and the actual nursing staff, not quite like a junior doctor. The information also provided reassurance of hospital care and support. Patient participants talked about feeling better informed about who is providing their care and feeling safer in a strange environment. Additionally, the intervention generated anticipation of the informational benefits of the PA, particularly about personal care and treatment, but patient participants were not clear if and how they could personally access the PA for this information. Patient participants wanted more explicit communication of permission to engage with the PA and how they could be contacted, if they were interested in finding out more detailed information about the PA role or what the PA could do for them personally, particularly to learn more about their care and treatment. It does need that little bit more information. When do you contact them? How do you contact them? One patient participant reported. PAs themselves suggested patients be facilitated to seek additional information if they wanted. For example, by adding to the leaflet the words, "For more information, please ask me." To conclude, an adapted, experience-based co-design approach supported development of an intervention tailored to patients' needs and preferences. It was considered feasible to use in the acute hospital setting and acceptable to patients and PAs. Patients appreciated and understood the intervention, and it seemed to have the potential to improve their hospital care experience, generating reassurance of care and support in line with the study's theoretical context. The evidence is encouraging, supporting future larger scale testing and similar interventions to improve identification and understanding for other new professional roles. We would like to thank all those who helped with this study: patients, patient representatives, PAs and hospital staff, and the Patient Research Expert Group in the University's Centre for Public Engagement. If you would like more detailed information about this study or our wider work on physician associates and other new mid-level health practitioner roles, please contact us.